Hi everyone, welcome back to Dr. Deepa's Learning Launch. This is the fifth video on the IHC series. So yesterday we were discussing about primary antibody binding. The further steps after this depends on whether you use a direct methodology of detection or an indirect methodology of detection or any unlabeled methodology of detection. So if it is a direct methodology of detection, then there is a labeling directly of the primary antibody and the color is detected. If it is an indirect methodology that you're using, then a secondary antibody is made to bind to the primary antibody which has binded to the antigen, and the color labeling happens to the secondary antibody. Both these methodologies are different and have their own advantages and disadvantages. If it is the direct methodology that you're talking about, then the speed of processing is much lesser, obviously, because you're not using a secondary antibody, and it is more specific. Although the sensitivity is lesser than that of an indirect method, the background staining is also much lesser in the direct method, and it can be used very well for multiplexing. If it is an indirect method, then the sensitivity is higher, but it is less specific because there is more background staining. It makes multiplexing more difficult, and it is also a more time consuming process. So you need to weigh both these methodologies depending on the tissue that you're handling and choose one of them very judiciously. Usually for skin and kidney, a direct or a primary antibody labeling itself would suffice, and that is what is used. There are novel methods like usage of horseradish peroxidase binding to the secondary antigen, which uses a dextran polymer. So these methodologies have gained popularity because it allows a multicolor panel to be used in the staining of the IHC. So these are the basic methods of labeling of IHC. We would be going through the unlabeled processing of IHC tomorrow. So stay tuned to Dr. Deepa's Learning Launch. Learn IHC with me on a daily basis. Don't forget to like and subscribe my video.